Hello, my name is John Cullen from Queen Street Osteopaths. This video is some little exercises to help with knee discomfort. We often assume that our knees only have a hinge joint and they bend backwards and forwards because that is the way we often see our knees working. But as osteopaths, we're very concerned with how the accessory muscles, the twists and the turns, and the other parts of the knee movement that will accommodate the various things we want to do with our knees. Our knees have a lot of movement in them. Sometimes we twist our foot on the ground, sometimes we twist the other way, other times we go down and then we turn around. So our knees are asked to do a lot of variable work. So sometimes the knees become problematic. Now, if people have a large ruptured tendon or a fresh major injury or break with their knees, it's best that they take advice before proceeding with this. The simple exercise is to find a platform where your knees can hang down straight. For this exercise, the knee should be approximately right angle and the lower leg hanging straight down. There are two variations on this. The first one is just to swing your legs. Pretend you're a 4-year-old if you really like. And give that 2 minutes. What this is because the leg is pulling down on the knee, it is opening up the joint a little bit and then moving it around to enable the fluids of the knee to process well. The second variation, this one here requires a place where you can actually swing your legs backwards and forwards without banging your heels. If you haven't got a surface like this, you can either sit with a higher chair or a bar stool, or maybe put an ordinary chair towards the edge of a step, being careful. The second one is called shaker leg. So basically you twist the leg backwards, round, left and right, left and right, left and right, and give that about 30 seconds of shaking, and then let it rest. The reason why these exercises work is because quite often there is some debris accumulating in the middle of the knee. With wear and tear, there's a lot of frayed edges around pieces of cartilage. So by tractioning open the joint and wriggling it around, the simple explanation of this is that it allows the debris to go to the edges of the joint rather than sitting in the middle of the joint where the two surfaces bang together. So give that a little bit of a release. I've had clients who are waiting for knee surgery who find these techniques very helpful to give them some relief and to encourage the fluid movement within the knee. So if you've got a more complicated injury, it's worth actually getting some professional advice before you take up any exercise. Thank you.